dental implant is often called a game changer for replacing missing teeth. But are they really as perfect as they seem? What if the perfect smile you're dreaming of comes with hidden risks? Yes, there are some risks you need to know about dental implants before you make that decision. We have categorized these risks into 6 categories, and finally, we will tell you how to avoid all these risks. So grab a seat, maybe a snack, and let's unpack the hidden risks of dental implants. Before we get into the risks, let's quickly cover what dental implants are for anyone new to this. A dental implant is like a high-tech replacement tooth. It's a titanium screw that's surgically placed into your jawbone to act as the root of a missing tooth, topped with a crown that looks and feels like a real tooth. Sounds amazing, right? And it can be. Implants have a success rate of over 95% in many cases. But like any medical procedure, they come with risks. Let's break them down so you can make an informed choice. Risk number 1, surgical risks. First up, let's talk about the risks that can happen during or right after the surgery. Dental implants involve cutting into your gums and drilling into your jawbone, so it's no surprise there are some surgical risks to watch out for. Infection. One of the most common risks is infection at the implant site. If bacteria sneak in, say, because of poor oral hygiene after surgery, you could end up with swelling, pain, or even pus. Yuck! In serious cases, an infection can cause the implant to fail completely. Studies show infections happen in about 1 to 10% of cases, depending on how well you follow your dentist's care instructions. Nerve damage. Another rare but serious risk is nerve damage. If the implant is placed too close to a nerve, like the inferior alveolar nerve in your lower jaw, you might feel numbness, tingling, or even chronic pain in your lips, gums, or chin. This happens in less than 1 to 2% of cases, but when it does, it can be a big deal and sometimes permanent. Sinus problems. Now, if you're getting implants in your upper jaw, there's a chance they could affect your sinuses. If the implant pokes into the sinus cavity, especially if your sinus membrane is thin, you might end up with sinus infections or discomfort. Again, this is rare, but it's something to discuss with your dentist, especially if you've had sinus issues before. Bleeding or hematoma. And let's not forget bleeding. Most surgeries involve some bleeding, but in rare cases, excessive bleeding or a hematoma, a pocket of blood, can form and need extra treatment. Your dentist will usually catch this early, but it's something to keep in mind. These surgical risks sound scary, but a skilled oral surgeon and good planning, like using CT scans, can minimize them. We'll talk more about how to stay safe later, so stick around. Risk number 2. Implant failure risks. Okay, let's move on to the next big category, implant failure. Even if the surgery goes perfectly, there's a chance the implant might not work out long term. Here's why. Osseointegration failure. The magic of dental implants is something called osseointegration, when the implant fuses with your jawbone to become rock solid. But sometimes that fusion fails. Maybe your bone isn't dense enough, or you're putting too much pressure on the implant too soon, like chomping on hard candy. Smoking is a big culprit here too, because it slows healing. When osseointegration fails, the implant gets loose and might need to be removed. Peri-implantitis. Then there's peri-implantitis, which is a fancy term for inflammation around the implant. Think of it like gum disease on steroids. Bacteria build up, irritate your gums, and can even eat away at the bone holding the implant. If untreated, it's a one-way ticket to implant failure. Regular brushing and flossing are your best friends here. Mechanical failure. And don't forget mechanical issues. The implant itself, or the crown on top, can crack, loosen, or wear out over time, especially if you're a teeth grinder or love chewing on ice. Quality materials and a good dentist can help prevent this, but it's a risk to keep in mind. Risk number 3, bone and tissue complications. Next up, let's talk about what can happen to the bone and tissues around your implant. These are less common but can cause big problems if they happen. Bone loss. If periimplantitis or poor implant placement happens, you could lose bone around the implant. That's bad news because the implant needs strong bone to stay stable. Over time, this can make the implant wobbly or even cause it to fail. Gum recession. Gum recession is another issue. Sometimes the gums around the implant pull back, exposing part of the implant or making it look less natural. This can also make it easier for bacteria to sneak in and cause trouble. And here's a rare one: allergy reactions. Most implants are made of titanium, which is super biocompatible, but in very rare cases, some people might react to the metal or the materials in the crown. If you have a history of metal allergies, definitely mention it to your dentist. Risk number 4, aesthetic and functional issues. All right, let's talk about something that hits close to home for a lot of people: how your implants look and work. Because nobody wants a smile that doesn't feel right or look good. Poor aesthetics. If the implant or crown isn't designed well, it might not match your other teeth in color, shape, or alignment. Imagine spending thousands of dollars and ending up with a tooth that screams fake. A skilled dentist with an eye for aesthetics is key here. Speech or chewing problems. And if the implant is off just a little, it could mess with your speech or chewing. You might slur a bit or struggle to bite into your favorite foods. Thankfully, this is rare with proper placement, but it's worth mentioning. Risk number 5, systemic and lifestyle risks. Now, let's get personal. Your health and habits play a huge role in how well your implants do. Here's what you need to know. Medical conditions. If you have conditions like uncontrolled diabetes, osteoporosis, or autoimmune diseases, your body might not heal as well, increasing the risk of implant failure. Make sure your dentist knows your full medical history. Smoking. Smoking is a major no-no. It reduces blood flow, slows healing, and can double or triple the risk of implant failure. If you're a smoker, quitting before and after surgery is one of the best things you can do. Medications. Certain meds like bisphosphonates for osteoporosis can mess with bone healing. If you're on these, your dentist needs to know so they can plan accordingly. Risk number 6, long-term and other risks. We're almost at the finish line, but let's talk about long-term risks and a couple of other things to consider. Implant longevity. Implants are built to last, sometimes decades, but they're not invincible. Wear and tear or changes in your oral health might mean you need maintenance or even a replacement down the road. Adjacent teeth damage. If the implant is placed poorly, it could bump into the roots of nearby teeth, causing damage that might need more dental work. That's why choosing an experienced pro is so important. Financial and emotional costs. And let's not sugarcoat it. Implants are expensive, and complications can add to the bill. Plus, if something goes wrong, it can be emotionally tough to deal with a failed implant or an imperfect smile. It's not just about your wallet, it's about your confidence too. All right, I know we've thrown a lot of risks at you, but don't worry, there are ways to keep these risks as low as possible. Here's your game plan. Choose a pro, go to an experienced oral surgeon or periodontist, check their credentials and reviews, get a thorough checkup. Make sure your dentist uses CT scans and evaluates your bone health and medical history. Follow the rules. Brush, floss, and follow post-op instructions like your life depends on it. Live healthy. Control conditions like diabetes, quit smoking, and avoid habits like teeth grinding. Stay on top of it. Regular dental checkups can catch problems early before they become disasters. By taking these steps, you're setting yourself up for a successful implant that could last a lifetime. And there you have it, folks, the hidden risks of dental implants and how to avoid them. Dental implants can be a total game changer, but knowing the risks helps you make the best decision for your smile. Have you or someone you know had dental implants? Drop your experience in the comments below. I'd love to hear about it. And if you found this video helpful, give it a big thumbs up, share it with someone who needs it, and subscribe to Medical Miracle for more health insights that make a difference. Until next time, keep smiling and stay miraculous. See you in the next video.